Thank you, Madam Chair, and thank you all for being here today. My first question today is to Mr. Toy. In your testimony, you mentioned that AI platforms like Clover Assistant can very quickly bring together fragmented patient data and integrate it into existing clinical workflows, even in practices that are still paper-based. From your experience, what steps do you believe Congress can take to support a wider adoption of AI-enabled tools like yours, especially in rural areas where providers may lack access to modern EHR systems?
Thank you for the question there. I think the most important thing, I know this is discussed at the in Congress, is making sure that there is connectivity to the internet within any practice within America. Like, I know that's a focus already, but once we can connect physicians to the internet, we can then connect them to cloud-based AI, and then we can also connect them to the vast amounts of data that we will bring online via interoperability. So I think those things all chain together, and if we'll solve the connectivity problem today by giving out devices to people like connected iPads, we'll help them work with their local telcos to connect. But if that could be solved, we can pretty much fix the rest.
Thank you. I'll follow up, Mr. Toy. In your testimony, you also provided a good example as to how a lack of coordinated care can lead to missed warning signs. Much of my district is rural Ohio, and so many of my constituents have complained about fragmented care. How can Congress help accelerate connectivity and data sharing, especially between independent specialists and primary care providers, so that AI tools can deliver the full picture of patients' health in real time, regardless of where care is delivered?
Yes, thank you for that. I think that a huge part of what we can do here is that connectivity to the internet, and then within the healthcare ecosystem, making sure that the interoperability rules that are being passed right now and future rules are all being accelerated and enforced. We want more EHRs talking to each other. We want to collect the lab system to that data stream. We want the pharmacies connected to that data stream, and all of that can come together. And once we have that, and I think we're very close to that, we want to make that to be physician-mediated, which it is right now. But I also encourage us to consider making it patient-mediated as well. A lot of the networks right now are for physicians to request data, and we also should allow patients to request their own data off those same networks.
Agree. Thank you very much. My next question is for Dr. Ibrahim. Thank you for being here today. Dr. Ibrahim, Viz AI platform integrates AI to speed up diagnosis and enhance care coordination across specialties and physicians. Given your background in both clinical practice and healthcare delivery, how do you see this benefiting both physicians and patients, especially in rural and critical access hospitals?
Thank you for the question. One of our important studies around improvement in care for rural patients comes from TriHealth in the Cincinnati area in Ohio. One thing I've noticed in my own practice, we often have rural patients that may have a concerning sign on one of their imaging studies, and they get transferred 3 to 4 hours to a big academic center. We may not have the imaging, we end up rescanning them, or if we have the imaging, we can look at it and say, actually reassure them and tell them it's okay. It's hard to estimate the number of patients who've been transferred only to give them reassurance and have them drive back home at no small burden. So the ability for us to leverage this technology to share information, readily get expertise eyes on some of this imaging before asking a patient to take on the travel burden would be significant. There are also many conditions where the care can stay local, but if the expertise can be disseminated by sharing information, it could also help maintain the volume of care that stays local in rural communities.
Thank you. Is there any concern for error in using these technologies for patient care?
I think we need to be incredibly humble that all of us here, including the people on the front line of doing this, are always learning something new about it, and that as good as our models get, as we get more experience, they get better and we learn. We try to put several safeguards in place to try to mitigate and anticipate that. You heard multiple times today about having humans in the loop. We also have additional monitoring safeguards that also alert us that if there's some signal change in how many things we're detecting, we start to go back to the providers and say, is there something different about the patients you're screening? Is there something different about the information you're giving us? Because the signal started to look different acutely. So we try to put multiple safeguards in place to prevent that.
Okay. Thank you all very much. Mr. Parker, I apologize. I was going to have you next, but I'm out of time. So, Madam Chair, I yield back.